Good morning, good afternoon, or good evening, depending on from where you are connecting. Welcome to this official side event of the TICAD conference. This side event is being co-organized by the Stop TB Partnership and the World Bank Group. I am Suvanand Sahu from Stop TB Partnership, and I will act as the MC of this meeting. This meeting is on securing the finances to save lives in Africa from tuberculosis. 550,000 people in Africa die each year from tuberculosis, a disease which can be diagnosed, treated, prevented. This should be unacceptable. And this 550,000 represents a mortality of 22.5%. Imagine 1 in 4 getting TB in Africa is dying. This should be unacceptable. So let's focus on one of the reasons for this, that is lack of funding. So right away, I would request Ruchika Dityu, who is the Executive Director of Stop TB Partnership, to give her opening remarks. Over to you, Ruchika.
Thank you very much. I want to start by thanking our colleagues from the World Bank for co-hosting this event to us, and our big thank you and my personal thank you to Dr. Hajime, our friend, and not just the friend of the Stop TB Partnership or of us, but I think a man with a big heart for people with TB, because, sir, you really care about the TB matter. Thank you very much. And I want to thank our colleagues from the World Bank and Mr. Dar, who will follow after me, for making the time to be with here today. Not anything less of that, thanking all of you being online with us, colleagues as speakers and members of the panels, but also you as the participants. In such an important conversation within the big platform of TICAD. And for many years, we know that the TICAD events and the TICAD meeting is a reference point for the engagement in the African region of the Japan government. And we are very happy to have a long-standing partnership with our colleagues from the Ministry of Health, as well as from the Ministry of Foreign Affairs of Japan. My remarks will be around 2 points. One is, thank you for the time. Today, we plan to speak here on 2 topics, kind of, that are intersected. One is about TB in the African region, and for too long, still continuing, unfortunately, the African governments, not all of them, but some majority, seem to be oblivious or not to take serious tuberculosis, in spite of the fact that in several countries, it kills many more people than HIV or even HIV and malaria combined in the African region. In spite of that, it seems to be some, okay, they are there, they die, not enough attention and not enough resources. And resources is the second point that we speak about. It's about the money. TB is severely underfunded globally. But unfortunately, what we observe in the African region, and this is something that should worry not necessarily just us coming from New York, from Washington, from Geneva, from London, from Tokyo, should worry the countries themselves, because what we observe right now is a very, very small contribution from domestic resources to TB. In most African countries, that is below 10%. That means that less than 10% of the money needed to fight and end TB in a country are put by the own government. The other is put by a donor or another, and also the rest remains as a huge gap, because donors can put 3, 4 times, 5 times more than the country, but never can put up to close everything. It is worrying, the over-reliance in this region of contributions from donors for the health of people. I'm not even going to TB. And it should be a worry about the need for sustainability and continuation of the investments made over the years with such a small contribution domestically. I know it's not easy. I am not naive. I'm coming from a country which also has financial difficulties and, you know, is not a high-income country. So I know it's not something that can be sorted out quickly or by a webinar. But I think we have now an amazing lineup of speakers and participants that can take this problem, and we can start having discussions and suggestions to see how this genuinely and honestly can be addressed. I will stop here, and I will pass because we will continue the discussions during the panel, and I give the floor back to you, Saku. Thank you.
Thank you, Luchika. Next, we have Mr. Amit Dar, a Regional Director of Africa, Human Development Practice Group, the World Bank Group. The floor is yours, Mr. Dar.
Thank you, Dr. Sahu. Dr. Ditiu, Executive Director of the Stop TB Partnership, colleagues, we are really happy from the World Bank to co-sponsor this TICAD side event with you. And as we all realize, and I think, you know, I actually shouldn't add anything because Dr. Ditiu really passionately stated the big challenges that the world is facing and the region, Africa region, is facing on TB. But just to say some words that, you know, I think, you know, as all our attention over the last couple of years has been focused on COVID, there are many lurking threats to global health, as we all know, and this is especially true of TB. And while a lot of progress has been made in reducing TB over the last decades, and TB incidence and deaths in many high burden countries in Africa have actually gone down, I think the pandemic really threatens to reverse this progress, according to the WHO global report on TB. So in 2020, in 10 million cases worldwide, only 5.8 million were diagnosed and notified, which was an 18% drop from 2019. And for the first time, we've actually seen the number of TB deaths rising. And this is really a big concern because limited access to care and treatment, including that of multi-drug resistant TB, likely accelerate TB transmission rates. And as Dr. Ditiu so passionately said, a lot of it is also because of the lack of financing, which is going into stopping TB. We've also found that the pandemic's effect on TB incidence and mortality are likely to be exacerbated in the medium to long term. And some of our studies estimate an increase of new latent TB infections of about 23%, new active infections of about 11%, and TB-related deaths of over 20% over the next 5 years. So it's definitely a major concern to hear those numbers. And clearly, it seems like global TB targets do seem to be, unfortunately, off track now, exacerbated because of COVID. And so the actions to mitigate and reverse these impacts are very, very urgently needed. And we really need to move very rapidly in the Africa region to address this. So we in the World Bank Group are continuing to play a role, working with all of you and the governments to strengthen the prevention, detection, and treatment of TB, especially where it's most prevalent. And just to give you a few examples, we have, with our partners in recent years, enabled the development of Optima TB, which is a tool that gives national decision makers a better understanding of the burden of TB in their country and how they may use their resources more effectively to tackle TB. And I think it's been helpful not just to health officials, but also to the Minister of Finance and Ministries of Finance, who are always looking for ways to make the spending go further. So I think we are going to be doing more and more of this moving forward. We are also trying our best to work across various countries, to work with governments and other partners to strengthen health systems. And this has allowed countries to achieve economies of scale and respond to ranges of health threats. And so we are really trying to push this agenda in projects all over Africa and in countries where TB incidence is high, and to address these issues. And I think we'd continue doing more of this over the next few years. So finally, just to say, we all recognize TB is preventable and curable, but it does affect about a quarter of the world's population. And I think we all need to be equally committed to really see this as a global challenge and a global struggle, and to get this agenda fully back on track. And in Africa, this could end up becoming another major problem if we don't address it and if we don't put full emphasis on this. So I'm really very glad that this side event has been organized, and please remain assured of the World Bank's commitment to work with the Stop TB Partnership and with all of our other colleagues and governments to address this problem head on. So let me stop here and turn it back to Dr. Sahu. Thank you.
Thank you, Mr. Dar. That was very good, and thanks for your commitment. Now we go to the next section of the meeting. This meeting is about finances to save lives in Africa from tuberculosis. So the natural question, how much does it cost to end TB? The best person to ask this question is Paula Fujiwara, who is here with us. She is the chair of the task force that developed the Global Plan to End TB 2023 to 2030, just published last month. So Paula, please go ahead. The floor is yours.
Well, thank you very much, Sahu. And I'll be talking about the issue of ending tuberculosis in Africa using statistics, finances, and some of the interventions that we can do. So in this outline, I'll be using the global plan as the basis for the funding discussion, and to make the point that tuberculosis really brings value for money. I'll then share some statistics about tuberculosis in Africa, and then use the example of Kenya as what we can do in the continent. And then what do we do in terms of the funding? So the Global Plan to End Tuberculosis, as Sahu just said, was launched last month. This is a costed plan, so it can be used to make some decisions. It's very much linked to the SDGs, which is why we're going to 2030. And it basically is an advocacy tool. And it's going to be used for the high-level meeting on tuberculosis next year. The Global Fund replenishment is coming up next month. And also it's an important tool for the G20s. This year it's being hosted by Indonesia, and the following years will be in some of the high burden countries of India and South Africa, and also includes Brazil. There'll be other opportunities for that. And for the first time, the TB vaccine, ATB vaccine, is included, and I'll speak to that in 1 second. So the punchline is, tuberculosis is a great return on investment. And this, we've done some modeling in the global plan, and we took the modeling up to 2050, not just to the end of the SDGs. And for every dollar that's invested in the world, you get a $40 return on investment. And if you look at the low income countries and the lower middle income countries, that return is even greater at $59 for every dollar. What are kind of the resources that we need to end tuberculosis? And this is for the next 8 years, the whole time of the global plan. We will need about $250 billion. And then the graphic on the left, you can see that most of it is going to go for TB prevention and care. But the new thing in yellow is going to be vaccination, where we're going to have about $53 billion needed, but that doesn't start until 2026. We're also going to need continued research and development for the new tools. Now, Africa is going to need just over a quarter of this budget if we exclude the R&D from the denominator. And you can see on the graphic on the right that the big yellow grouping there is it doesn't start until 2026 because we anticipate to have a vaccine by 2025. We'll need the 2026 to 27 year to ratchet up to full use. So what are we going to get for this money? The idea is that we will basically diagnose everyone with tuberculosis and really focus on the high risk and key and vulnerable populations for tuberculosis. It means that 50 million people will be able to access treatment, and this includes 4.7 million children and a large number of people with drug-resistant tuberculosis. 35 million are going to be able to access TB preventive therapy. I'll say a few words about that in the African context in a second. And there's going to be at least one vaccine for widespread use, as I just showed in the last slide, by 2026. And compared to the 2015 deadline, which is when the SDG started, we'll had an 80% decline in the number of people with tuberculosis and a 90% decline in deaths. So in terms of some of the statistics for the global statistics and also particularly for Africa in the next 8 years, we have various categories of people notified, especially children and people with drug-resistant tuberculosis. But I call your attention to the issue of prevention. For globally, we're going to need prevention in adults and children, but especially in people living with HIV/AIDS. And this, in the African region, you can see that 71% prevention is going to be a key issue for Africa. This was just mentioned in terms of the resource needs for Africa in the next, this is data from, from WHO, and this is looking back to 2017 and up to 2021, which is the last year for which we have data. If you look on the left, and this point was made between 2017 and 2021, you can see, unfortunately, that big orange blocks, and this is the unfunded need for tuberculosis in Africa. And if you look at 2021 in particular, if you look at the national TB budget, the need is huge. $1.3 billion is needed. The funding sources from domestic sources is 22%, but the unfunded aspect of the budget is going to be $595.8 million, which is well over 50%. So this is a big concern for the continent. Let me use Kenya as an example of what can be done. We did this modeling for the global plan. And so this information is in detail in the global plan, but using Kenya as a prototype for Africa, what do we need to end tuberculosis in this example? First of all, Kenya needs better TB diagnostics. And a lot of the budget that will be put in for the next 8 years will be in the need for diagnostics. And we need to find the people who actually have the tuberculosis already. These are the people with symptoms. And this means that we need to do more active case finding and increase the demand for existing services. Kenya is already looking for additional people with tuberculosis by looking for subclinical TB. These are the people without symptoms, and these can be identified, for example, by X-ray. And a key issue for this continent, as I just showed you in the previous slides, is preventive treatment for the key and vulnerable populations, especially HIV. So vaccination will be needed, will be useful. However, that if we do the preventive treatment in Africa, the mass vaccination with the new TB vaccine doesn't need to be full scale, but can be around 1/3 to about 40% of the population. So where are we going to get this money? Obviously, domestic budget, as was pointed out already, is going to have to be increased. The Global Fund is the biggest external source of funding for tuberculosis, but it's insufficient. Tuberculosis only gets about 18% of this full budget. Replenishment is coming up. I think we're aiming for $16 billion, and maybe it'll increase a little bit, but it's not going to be enough. So we'll need to get loans, as talked about by our colleague from the World Bank, and then private sector financing, high net worth individuals, all social health insurance schemes in countries, any external fundings beyond the Global Fund. For example, the Global Fund does not provide money for research. And so this research funding source is going to have to come increasingly from governments and all the other sources like philanthropy in the private sector, and also innovative forms of financing. So in 2018, at the TB high-level meeting, there was a message for the ministers and the heads of states. It was just these 16 words. You treat all people with TB well, you use new tools, you make the investment, and you keep your promise. And this is going to be the same that we're going to be needing for the next 8 years as we get to the end of the SDGs. Thank you very much.
Thank you, Paula. So that was from the global plan recently published, costed plan to end TB by 2030. We don't yet have the Minister of Nigeria connected. Mohammed, if you can confirm that. We don't see him there, but he is expected. We will do a slight change in the agenda and we will move to the panel discussion first. And then when the minister connects, we will break for his speech. So we now go to the panel discussion. We have an eminent group of speakers on the panel, but the panel will be led by, moderated by Luchika Ditiu. So I hand over to Luchika for the panel moderation.
Thank you very much, Sahu, and I want to thank very much to my to the colleagues that are here online and will be part of the panel. We are.
Luchika, I'm told the minister is online.
Okay,
so I
great.
suggest we go to the minister.
Of course, he is supposed to be here. So, Your Excellency, why don't we go ahead?
Yes. So we have His Excellency Dr. Osagi Emmanuel Ehanir, Federal Minister of Health of Nigeria. Sir, the floor is yours. Please go ahead, unmute and put on your camera and please go ahead.
I hope it works. I don't know if IT or somebody is with you, sir, Itohan, to help. Okay, because the other colleagues as well as the audience are waiting and I see no movement on that connection. I suggest we go ahead with the first speaker of the panel and then we revert once things are clear. And I suggest that our team that helps us with this gets in touch with His Excellency Office and helps. So we have a panel and actually it's actually a great start because we don't need to, you know, the purpose of the Minister of Health of Federal Minister of Health of Nigeria is to really reflect on the things as a Minister of Health in securing a budget for TB and to continue the fight, and to give us a keynote speech. But equally, how to say, difficult to lead this fight is by those that are on the front line, the TB program managers, the leaders of the programs. And I'm very honored to go with a fellow lady and friend, Dr. Stavia. She's the Assistant Commissioner for TB and Leprosy Control Division in the Ministry of Health of Uganda. Not only an amazing and good friend for us in Stop TB, but also an amazing fighter for TB in Uganda. Dr. Stavia, I saw you. I know that not only that you are online, that your camera was working. So, Dr. Stavia, if you can mute and put the camera on, and if it will be really good if you can reflect a bit on the funding needs and funding gaps in the TB response in Uganda and the challenges that you face in mobilizing these funds, as well as what kind of support you think you need for resource mobilization. So Dr. Stavia, with a lot of respect, please, the floor is yours.
Thank you, Ruchika. All protocol observed. Good afternoon to all of us. The introduction is well done. Uganda is one of the high burden tuberculosis and tuberculosis HIV countries globally. And we'll surely need to press the required resources to be able to move out of this. So what challenges, what is the gap of funding that we see? First of all, we have up to 2025 strategic direction where we wish to reduce the TB incidence by 20%, minimal reduction because we are cognizant of the funding requirement. Moving the TB agenda requires substantive resources. For this strategic direction, we had challenges in costing it, first of all. So we could only cost easily activities that have been well known. We used the One Health tool, and we got up to $275 the total cost for 5 years. But when we compare this with what is the global plan estimates for a country such as us to address the TB problem, it is up to the tune of close to $700 million US. So you can see, first of all, the challenge in costing that we face as a program. But also with this budget, what have we been able to realize as we implement the strategic direction? If you look at the Global TB report, the most recent one, up to 34%, I think, of our budget was unfunded. Although that was a reduction, we want to thank our development partners that there was improvement in the investment in TB in the country to that level, but is with costing. So if you look at that in the perspective, a global for TB, $100 US I talked about for a 5-year plan, the gap is much higher. It goes up to close to 50% or more than 50% of the plan not funded. So the funding gap is huge for the program. And the challenges that we are facing in mobilizing resources, one is in quantifying the actual need that we need, the tools that we are using, the expertise that we are using to be able to exactly come to what is expected to be invested in the country to meet the end TB targets was a challenge. We attempted to put down the interventions highly, which are really highly thought to be highly effective and impactful, but the costing of some of these things were not in the tool that was used. The other key challenge that we are facing, most of the funding for TB is related to identifying a case, which is good because once we remove the infectious cases, we are on the road to ending TB. But we also know that now we need to reach out to have effect and stop progressive disease. We need more funding direction as well. But most funding that are available has been identifying a case. Interventions that are not resulting in identifying an active TB have not been very welcomed in our development partners. The other challenge that is with the TB is that there are no specific funds out for us to our hands into the global fund for identifying TB of the key areas for funding. US is also prioritizing TB And PEPFAR, although the PEPFAR is tied to the HIV funding, when we look at the component TB, HIV alone, we find TB is more than HIV. We find that you to be able to TB, you need resources that are specifically TB. We have not had investment in research, for research, as a country, but I think so globally. Recently, we have seen the prioritizing research and benefit from this as the other area where we so when you have a very well planned, the advocate becomes very hard in engaging the parliamentarians and every engage them. They want what is it that need, but we have it very well done. It can be tabled policy makers, the appropriate funding to see if they can contribute. We are working on this. We want to seek support from the expertise to improve on our costing and come up with an investment case, which will clearly show the that need support. Thank you for inviting us as Uganda experiences in mobile resources for TB.
Thank you very much, Dr. Stavia, for being with us. I also note some good points made by our friend Stephen in the chat. And I think, Stephen, we can discuss with them at the end. I think we are going very well with the timing. So I know that we will have some time for discussion and your points are very good and pertinent. Thank you. But Dr. Stavia, thank you for bringing the reality and the challenges that you are facing and the struggles with to achieve a lot in pushing forward the agenda, and you have a lot on your plate, so we also need to support you, all of us, and stay around you and in pushing forward for more resources and so on. I know that the keynote speech of the minister was your responsibility, Sahu, but I just want to see if the colleagues from Ministry of Health of Nigeria are ready to have the minister speaking. Is the minister around, or
so the minister's connection is there. I think it.
I know.
Disconnected.
No,
but
I
it's
know.
back now. Yeah.
No, they are there, but I don't know if that means that you know, he has a team that connected and waiting for him to come. I don't know what's the status. So, if we hear nothing, with all the love, we will have to move forward. And I am very pleased to enter into a discussion and to give the floor to our next panel member, which actually will answer two questions into one. I'm happy, Bjorn, that you are able to be with us. Bjorn is the president of the Copenhagen Consensus Center. And I really like that everyone here to see him as an independent, very strong voice, uninfluenced by anything on a lot of finances aspects. He's not speaking just from his mind, but the entire center around investments that are providing a good return or that are smart. And Bjorn, I know you are stepping out of a meeting to join us, so I'm very grateful for that. And I know you are under big pressure, but I think if you can clarify for us two small things, two important things, short questions, important topics. Is TB a smart investment, first of all? And we know that many high TB burden countries have started developing their national strategic plans. And what would be your advice to these countries? And in what way your group can help these countries in developing smart investment cases for TB? Bjorn, the floor is yours. You are muted. Bjorn, you are muted.
Well, two years after an epidemic, and I still can't figure this out. Thank you very much, Luchika, and thank you very much for allowing me on this very esteemed panel. So if I can just take a step back, what I do, and I work with more than 300 of the world's top economists. We work with more than 7 Nobel laureates in economics on trying to find where can you spend a dollar or a shilling or a rupee or whatever your currency is and deliver the most result for the world. And so my answer to your first question really is, not surprisingly, given that you invited me on the panel, but what we show is that there are some incredibly effective and very, very simple things that you can do that could have a huge impact for the world. We did this for the UN as the only cost-benefit analysis across all the UN Sustainable Development Targets back in 2015, and we're now planning an update that will come out early next year. But what we found was, and we found this in many different countries, is that consistently TB is one of the best investments in the world. So the simple point here is to say, if you look across all areas where you could spend extra money, and you could make improvements both on social impacts, on economic impacts, on environmental impacts, and try to add up all of those, it turns out that TB, spending money on those very simple things of making sure that people stay on their regimen, that they get diagnosed and that they get treated, if you spend money on these very simple policies, you will deliver one of the highest returns on your dollar, rupee, or shilling, or whatever your currency is. So the fundamental point, and the answer to your first question, Luchika, is really just, yes, TB is an incredibly good investment, not just for the world, but for your government. So we've done this in 2 states in India, we've done it in Ghana and Malawi and many other places, and we systematically find that this is true also in Bangladesh, many other places. The point then goes really to your next question. How should people around the world take up this information? Well, I think the important part is we often get sort of wrapped up in our own little world, and we all convince each other within the TB community that TB is a great investment, that this is really something that the world should be focusing on. But of course, we have to convince everybody else. And remember, perhaps especially, we have to convince the finance ministry and the finance minister, who are the ones who dole out money from the public budget. And the point is, they get a lot of other people telling, you should do my thing. Oh, no, you should do this thing. You should need to also address these issues. And it's not unreasonable that a big nation have lots of different challenges that need lots of money. But, and this is the point I think that I want to answer your question with, is simply to say, when you come to the finance ministry and when you come to the finance minister, you should tell him that the Copenhagen consensus analysis, and this is just not me talking, this is not just a couple of people, this is what we found consistently and also globally with some of the world's best economists looking across a vast range of areas. Investing in TB is one of the best ways, one of the most cost-effective ways to save human lives, to do the most benefit both for economics, for social and environmental impacts. Obviously, we're basically looking at all these three, but main impact from tuberculosis is on social benefits, basically making sure people don't die and they can continue to be productive. What we find is that every dollar or rupee or shilling, all of these work in the same way, but I'm just going to say dollar here, every dollar spent will deliver $43 of social benefit. In some countries, for instance, in Rajasthan and India, we found that it can deliver up to 180 rupees back on every rupee spent. The point is that sort of messaging is convincing to finance ministries. It's convincing to prime ministers and presidents. It's convincing to a lot of people who are not normally in the TB field. So I would love to help you and help anyone who really needs it to push this conversation, not just that TB as a terrible disease and that we have great ways to deal with this, but that it's an incredibly cost-effective way to make society better. And I think that's the main point that really can help sort of push this conversation beyond just saying this is something we ought to do, but actually saying this is something that's incredibly smart to do. I hope that answers your question, Luchika. Yes,
and so thank you so much, Bjorn. And it answers my question. It gives us a lot of hope. And the kind of, how to say, evidence and the kind of thinking that you put up here is needed at country level a lot. And I am speaking with you now from Lagos after an amazing mission we had here. And I think, we promised to help Nigerian government and especially the TB program. And I hope our colleague from the TB program is here, the manager, because he was very vocal as well as our partners to develop for Nigeria an investment case and the return for investment case to make it even stronger and to be specifically tailored for Nigeria. So we promise to help with this. So we will obviously work together to support a country like Nigeria. Thank you so much, Bjorn.
Thank you very much, Lucia.
You are under pressure, so you do what you have to do next, because we will need you in other instances. So, we want to be very clear with the time. So, okay, so I see in the chat from our colleague, the manager of the program, that is not, the minister had to go and see the president for an assignment. So, but our colleague from the program, the leader of the TB program in Nigeria, Dr. Anyaike is with us. So we are very good friends after a week spent together here on high-level conversations on domestic resources. So Dr. Anyaike, why don't you take the floor and share with us your experience from Nigeria in looking at the domestic resources and as well as investments for TB response.
Hello, thank you, Dr. Lustika, for giving me the audience and for the support you rendered to the country. Both of us have been on the move since Sunday when you came into the country, and we have been moving, trying to. Hello, I hope you can hear me. Hello.
Yes, we can hear you. Yes, go ahead.
Yes. Yeah. So, we've all, with the support of Stop TB Partnership, we've been able to make some advocacy visits to the major stakeholders. I'm sorry, you may have some distortion in my because I'm currently on transit. I'm in the airport now. So looking at our funding gap in the country, we started to bring up all the major stakeholders on board. First of all, we know that like what the previous speakers spoke, we just know that the Ministry of Finance is very key in terms of understanding, the problem we have on tuberculosis. But surprisingly, which is not only in Nigeria, we found out that most of them do not even know the burden of tuberculosis and the need for us for them to make a special case for tuberculosis. So after the mission, I think we've been able to let them know that we already have a problem in the country and that the 70% financial gap has to be fulfilled if we have to be on track towards ending the scourge of tuberculosis in the country. Most importantly, after that, we went to the governors forum where, that coordinates all the activities of the governors. Nigeria has, a tripartite and complex healthcare financing in the country, in the sense that we have the funding from the central government, we have the strength from the state government, and we also have strength from the local government. But however, at the moment now, the funding comes majorly from the federal government and the state government. So we are not wise enough to meet the coordinator of the governors forum, who has promised us to speak to the governors whenever they have their meeting. Of course, we need to give them the accurate data for them to know, for them to even know that there's a problem in their various states, which we have planned to do coming next week. From there, we went to the governor of Lagos State, who has started stood up to fight against, to support the program, to support the state. Lagos is one of the biggest cities in Nigeria, followed by Kano. But the governor of Lagos State gave us an assurance yesterday, and by that we are on the push towards using him as the speaker to all the 36 state governors. And we strongly hope that we'll be able to change the narrative in terms of domestic funding for the country. We also have to invite the public sector, because we realize that 60% of Nigerians, first of all, go to the private health facilities, and we know that the private hub will play a very big role. The government may not be able to fix all the financial gaps in the country. So we had a very good, dinner yesterday, with the governor of Lagos State being present, and he has promised that he's going to charge the public sector to come in, startly to see what they can do to bridge the gap, in funding for tuberculosis in the country. We also notice that, we are lacking in the strength of awareness creation and letting people know that tuberculosis is being left behind. Of all the 3 diseases, in fact, all the infectious diseases, tuberculosis is being played down, and for me, it's seen like an orphan, which it shouldn't be so. If you come in terms of mortality and morbidity, mortality, you will see that tuberculosis stands out even more than HIV and even the COVID-19. But we've resolved as a nation to make sure that we tackle this strategically, while increasing the awareness and making people know, because we have the data. That's the way we're able to improve on our case finding in the country. That we are going to use to put the data, because the data speaks for itself. So once we result to let people know that this is the problem we have in the country, speak to the major stakeholders, the civil, the media, the public, the private sector, and also the Ministry of Finance and other stakeholders, to know that with increased funding for tuberculosis, we'll be able to make a great big impact towards keeping out tuberculosis in the country. We have not forgotten that the global push towards integration of services. The first thing we have to do is to work on the strengthening the health system, which we are putting on our table. Let me also remind us that the country, in a bid to improve on the healthcare financing in the country, we've been able to come up with the basic healthcare fund, which will grab it for 1% consolidated fund from the country. And we're hoping that we're going to, impute tuberculosis amongst all the diseases that is being covered by that fund. Of course, we know that health insurance is a sure way. Tuberculosis cannot be a standalone in when we want to, if we want to make impact. But at the moment, we are being a little bit selfish to make sure that we bring up to speed the awareness, and also making much funding available for tuberculosis, so that we can meet up with the levels of other diseases in the country. So as a national program manager, I am giving the assurance that I will do my best as in ensuring that we improve on the awareness creation, resource mobilization, with the support of Stop TB Partnership and other stakeholders on board. Thank you very much.
Thank you very much. And I apologize. I think, yes, thank you, sir. Thank you, sir. I don't know if you hear me. I want to tell all of us here, we are, I am also in Lagos, and I know exactly what Dr. Anike is in the airport in Lagos. And these are the realities here. Internet is unstable, but I appreciate the time that you that's not able to join. So I will, looking at the time, I thank you for this. I want to give the floor to, as I presented before, the advisor for health, nutrition, and population at the World Bank. And I think a great supporter and a great hope for the people with TB, Mr. Hajime Inoue. And sir, we know that World Bank played a critical role in financing development in Africa, made investments in TB. We all think is potential for more. And I think that indeed, and observing here available from the World Bank. And if you can tell us a little bit about different opportunities or mechanisms that the World Bank has in Africa used for financing TB, including any smart, innovative mechanisms of funding results. Sir.
Thank you very much, Lutica. Am I audible to you?
Yes, you're audible.
Thank you very much. Thank you for the questions. And we, the World Bank, is happy to be a part of this community to work for TB. The World Bank actually provides core financing disbursements through its two major arms. One is the International Bank for Reconstruction and Development, IBRD, and the International Development Association, IDA. This is the second arm. The IBRD provides market rate loans, whereas the IDA delivers grants and low interest loans to low-income countries. Core funding can originate from either one of the lending agencies or via blended finances from both agencies. And one of the strengths of the bank's financing to TB is its multi-sectoral approach, such as TB in South Africa's mining sector. Let me just mention about one of the examples in South Africa on mine workers. Mine workers in the Southern African region is the highest incidence rates of TB of any working population in the world. The government of South Africa is committed to supporting a socially inclusive approach that expands opportunities in the mining sector, reduces inequality, and grows on partnership characterized by a shared vision, collaboration, and trust. Within this context, the government has pursued a range of innovative partnerships with public and private entities across the region to address the special vulnerability of mine workers to TB. This is one example of cross-sectoral work between health and the mining industry. Each country have a different needs in different contexts and the possibility of innovative financing. We're happy to discuss the combination of different financial tools that we, the bank, have locally at our country offices. Thank you very much.
Thank you very much, Dr. Hajime. Thank you very much for this. And I think to, diversify a bit, I will go to our next speaker right now, and then I will come back with another question to you. It's my pleasure and honor to introduce my colleague, Frank John Lule. He's the team lead for HIV, TB, and hepatitis in the WHO African region. And in recent years, WHO has provided updated guidelines on diagnosis and treatment. What do you think are the barriers that the African region is facing in implementing these new guidelines and tools? And how important is the lack of funding as a barrier, sir? Please. Thank you.
Thank you so much, Luchika, and my special thanks to TICAD for this special side event. It really brings out the issue of TB, that it is our problem in the African region. And we must find solutions that are appropriate to our continent. As you mentioned at the beginning, sometimes it's like we do not see that urgency to actually address the problem. And it is events such as this that we really need to push forward and find solutions to this. Now, on the specific question you have raised about WHO guidelines and recommendations, the main barriers that we face, here I'm talking about guidelines for prevention, treatment, and obviously diagnosis. The first one, which many colleagues have also mentioned, and it's really good that you started with the sharing experiences from countries, is that lack of awareness. And here we are not speaking just about the technical awareness, but we need to be broader to address the political audience that we have, not only at the highest level, but within our households, in communities, civil society, the private sector, and indeed other sectors other than health. That awareness is really the one that is going to give us the movement to implement these wonderful recommendations that we are pushing to countries. The other barrier, obviously, is the delayed buy-in. Sometimes we've had the guidelines which are evidence-based. We know they work very well, but they take really long for adoption and indeed implementation. We are working on that, working with national TB program managers to make sure that there is much more rapid adaptation and implementation. But beyond that, there is also limited capacity in countries. It's good you're in Nigeria. I've seen my friend Anyaike, we've worked together for a long time. That capacity in countries, even when we feel we really need to do this, is something that is a major barrier in countries to implement WHO guidelines. And among those barriers, as has been ably mentioned, and which is the subject of this webinar, is the issue of financing. And I really loved that presentation, which showed the blue for domestic financing, the yellow for international financing, which is really now the largest source of funding for TB within the region, and then the unfortunate orange area, which is really unfunded. And the answer, in my view, is really we have to work with communities, with governments, with stakeholders, partners to really improve the domestic fund bit of financing to make sure that we overcome this barrier. We have wonderful documents, but many times they really stay on the shelves. Obviously, the other barriers we've seen in the past 2 years is the issue of disruptions. With weak systems, any disruption, we are not resilient enough to really keep our programs moving, and we've really lost many gains that we've gained in the TB response. So I think that is the answer I can give on the issue of what the major barriers we have in the region for implementing WHO guidelines. Thank you.
So I think Luchika got disconnected. So let me take over the next one, and then we will hope that Luchika will be back online. So thank you, Frank, for your comments on this. But before going to the next speaker, can I ask you another follow-up question? How can TB benefit from the finances available for other larger initiatives led by WHO? For example, the universal health coverage, the recent one on pandemic preparedness and response, and also antimicrobial resistance. If you can tell us something about it. Thank you.
Yeah, I think the quick answer to that is really just to bring TB out of isolation. And we really need to look at the TB response in a broader sense, where we are able to look at TB as a component of the essential package for universal health care. And it's really good that now we are able to cost our needs for the TB response. I really believe if we have our costed national strategic plans, which are really components of the broader health sector plan, that should be able to capture budgets, funding for the TB response. We take that further, maybe in the medium-term expenditure frameworks, And that is what really speaks to our ministries of finance. And through that, we should be able to really capture TB in broader initiatives. If you look at AMR, for example, really, there is no way you can move the AMR agenda without addressing MDR or XDR. And I think we have been working with IMDR colleagues to really make sure that all the AMR plans include TB. So it's upon us as the TB community to really get out of our silo and integrate in a broader sense, use a systems lens, and also make sure that UHC involves TB. Indeed, one of the good things that is really happening, when I look at the major key performance indicators for UHC, we have TB indicators therein. And that means we really have to work with our colleagues to make sure that we fulfill these targets. And that can only happen by funding the TB response. Thank you. But just give me a minute. I know we talk so much on the technical aspects. Really, the elephant in the room is to make sure we get political visibility for TB in all our countries. I really liked that statement whereby we really push the investment agenda instead of all the time mentioning TB mortality, TB deaths, and so on. We really speak the language our finance colleagues understand, the language that politicians understand, the language that communities will be able to run away with. And of all the people that are going to make a difference, I'll just use, I used to be in the HIV space, is really the meaningful involvement of the people themselves. And sometimes when we say we are engaging communities, it's us, the technical people. But this really needs to be taken on by the communities themselves to really push the agenda. They hold accountable their political appointees or the people they elect. That is really what is going to move the agenda. Thank you.
Thank you, Frank, and thank you also for this last comment on the political leadership and their engagement. So I think it's very timely because the next speaker on our panel is from African Union. As we know, African Union convenes the political leadership, has the mandate to convene the political leadership in Africa. So we have Sheila Shawa, who is the senior technical specialist in humanitarian affairs and social development in the African Union Commission. So Sheila, two questions to you, and if you can take them together. First, how important is the agenda of ending TB in the African continent? What opportunities you see within the African Union meetings and activities to highlight TB for increasing political commitment? That's the first question. And the second one, the African Union has a scorecard for heads of state for TB. What has been the experience so far of using the scorecard to mobilize commitment of heads of states in Africa? And what is the plan going forward? So the floor is yours, Sheila. Go ahead.
Thank you so much. And I'm just happy that most of the speakers, the previous speakers, have actually highlighted what I'm going to talk about. So I'll just add to the conversation. So in terms of the agenda, how important the agenda is, I think it's one of the commitments that the heads of states have really prioritized. And I believe in terms of political commitment, we do have the highest level of commitment. And this can be seen from the declarations, decisions, and frameworks that the heads of state have really endorsed and are committed to, starting with the famous Abuja 2001 Then they reaffirmed their commitment in the Abuja 2012 plus. We have the Common African Position on TB. We have the outcomes of the UNHLM. We have the catalytic framework to end AIDS, TB, and malaria, which now got the Abuja declarations and tried to come up with even strategic approaches and things that countries should do, activities and interventions that countries should do to ensure that we end TB by the year 2030. We have the Africa Health Strategy, we have the Agenda 2063, and these are just some of them. So they are, in terms of the actual commitment on paper, the commitment is there from our heads of state. But I think the complexity comes in that these commitments are made at a high level, but there is need to create awareness, as the previous speaker spoke, and advocate for these frameworks in country. Because yes, the heads of state will make the commitments, but if the people, the managers at country level are not aware of this commitment, then there will not be that prioritization of the program in countries. So I think what this calls for is a multi-sectorial approach and coordinated efforts. And I like what one of the speakers said, to say, you know, when you say government, you mean all of us, because this calls for political commitment even in our relevant ministries. So it has to be at the ministerial level, at the program manager level. It has to be at the other ministries, Ministry of Finance, Ministry of Local Government. It has to be at district level, provincial level, and community level. If we get the political commitment, and if there's an understanding of what the leaders have alluded to and what they have committed to in terms of ending TB, then it will be easier for people to collaborate and really implement interventions towards the cause. I think this is what we are doing as the African Union, is trying to get those commitments and creating awareness in member states. And of course, the complexity of it all is that we do not have officers in countries, but we are working with our partners to ensure that this message is actually passed on to the relevant stakeholders in country. And also, you know, when the heads of state do commit to these frameworks, to these decisions, there's need for just an integrated approach and involvement of our sectors. So as much as we want government to play a role, we know that government is not capable of doing everything, and we've talked about investment here. So this is where we are actually trying to promote private sector engagement. We're trying to promote NGOs, CSOs, and communities, so that once we have a common understanding, then we can all have common interventions and work towards ending TB. With the heads of state making the commitments and no implementation or awareness or advocacy at national level and at the various levels in countries, it will be very difficult to actually implement efforts in a coordinated approach. So in terms of raising visibility, I think, let me also start by saying that we have also been advocating for investment and domestic resource allocation to health, and particularly TB. And I'm sure some of you are aware of our health financing initiatives that are calling for other stakeholder involvement apart from government also. So we are also calling for developmental banks, because we know they play a critical role in actually working with governments to ensure that they have a coordinated approach towards addressing health on the continent. And at the AU level, we are also trying, to answer the last bit of highlighting TB. And I think, as we heard from Frank, because we are talking about an integrated approach, what we've noticed is that TB is swallowed up. We have a lot of initiatives for malaria and a lot of initiatives for HIV, but we do not have as many initiatives for TB. So what we have been trying to do is, of course, we do have the hour meeting where we have an agenda for TB, AIDS and malaria, where we discuss these with experts from member states. States once every year, but we know that is not enough. So we are coming up with the concept of developing an annual meeting where we'll just be discussing TB, where we bring experts and just focus on TB, because we've seen this happen for malaria, we've seen this happen for HIV, but we're not seeing it for TB. We've seen this E8 elimination initiative, we've seen the Sahel initiatives to eliminate malaria, but we are not seeing this in TB. And so we are working towards seeing how we can actually try and mimic and try to, you know, see how we can come up with similar initiatives. And one of the things that we've also developed recently, as some of you, most of you on this call were with us, is to also ensure when we have these big meetings, like we had the regional committee meeting, we have an agenda of TB running there. So we're trying to ensure that at every meeting that talks about health, we have either a side event or an initiative that will just be focused on TB and TB alone, because we want to ensure that it does get the visibility that really has been missing and which the other diseases have been enjoying. And to come to the second question, yes, so we do have a scorecard which we have been producing every year since 2018. And I think the beauty of the scorecard is that it creates visibility on how member states are performing in addressing TB at national level. And so it just gives you a snapshot of the progress, and the country is able to compare itself in the number of years since 2018 of how it has been performing in addressing this challenge. So it gives, just without even looking at other countries, they're able to tell how they've been performing, whether they've been actually improving, they have been moving from red to green, or they've been moving the other direction. So it has really been effective, because we've been able to capture the aspects of catastrophic costs, and we deliberately indicated we included an indicator on domestic financing, because we believe that is also a sign that will show the commitment that we're getting from countries. And when we did start, we only had 7 countries that reported financing towards TB, and apart from 2, the levels of financing were really low. I think most of them were below 20%. But from 2018 to now, we have seen more than 50 countries financing the TB program domestically. We have seen we have seen about 4 countries that are financing about 70% of their national TB programs. We've seen over a good number, about 10 or so, that are actually doing more than 50% of the financing towards TB. And we have also seen just the other countries that were recording 0. I think over 60% of the countries now can actually have allocated some form of financing. We know this is not sufficient, but at least, we are able to trace the progress, and it just shows some level of commitment at country level. We know that we need to do more, and we know that we need to engage the ministries of finance and other relevant ministries to ensure that we really put up a case of countries domestically financing the TB programs. And we are really working on that with our partners, including Stop TB and WHO, to ensure that even at country level the data is captured and countries are able to really indicate how much of the financing is going towards TB. Let me end there.
Thank you so much, Sheila. I cannot agree more with what you said. Somebody asked in the chat if we can have the recording, and we will have it, and emailed as well. I think following Sheila, you are spot on, and we need this type of commitment and engagement and this type of partnership with the African Union. And in terms of leadership, you can for sure count on Nigeria, but especially on the governor of Lagos, that is really a champion for us and understands very well the need, as you said, to involve private sectors and other stakeholders if we really want to reach the needed funding for TB, as we discussed. I think, so thank you so much, Sheila. And as you know, to go ahead, and we as Stop TB, we will really look forward to our partnership with the African Union. I think right now fits very well my second question to Dr. Hajime. we know, because we know that World Bank has this arrangement with the Global Fund for Innovative Financing, blended loan and grant financing. And we have seen the joint work of World Bank and Global Fund in the loan buy down arrangement for TB in India. I think is on the making for Indonesia and another Asian country. As I was mentioning, there is some interest in the Nigerian government. We also discussed with a team from Ministry of Finance around that kind of arrangement. But beyond Nigeria, what should African countries do to benefit from similar innovative financing from the World Bank?
Lucica, thank you very much for your questions. And as you mentioned, the World Bank and the government of India signed a loan agreement of 400 million in 2019 for the program towards elimination of TB. This program is built on strategic partnership with the Global Fund, which is providing the 40.6 million to buy down the principal of the loan. And also the Bill and Melinda Gates Foundation, which is financing independent verifications of results and providing technical support to scale up private sector engagement. Such a partnership of the bank, Global Fund, and the Gates Foundation fulfill the kind of cooperation and innovative financing envisioned in the WHO's NTP strategy. In recent years, the Global Fund and World Bank have signed multiple innovative finance agreements, not only in India, but also other countries as well, such as a performance-based funding project in DR Congo and multi-donor trust fund for Indonesia and Sri Lanka. The framework agreement is expected to reduce transaction costs and lays the foundation for a deeper partnership with the aim of increasing impact. These innovative financing mechanisms complement the funding of the Global Fund and the World Bank and amplify domestic health financing. I think there is a lot of the opportunity for other African countries to also participate to these innovative financing, and we are very happy to discuss to each the countries locally at our country affairs. Thank you very much.
Thank you so much. Indeed, it gives hope. It's a way to really multi for TB. Without further ado, thank you. It was very clear. I'm going to a very close friend of us and also a leader for us, the vice chair of our Stop TB board and the executive director of Afro Global Alliance, Chief Obiefune Austin Arinze. And I want to ask him, and I know two things into one question. One is the role of civil society, of TB-affected communities in Africa to demand for TB, better TB services, better access as a matter of right. And what do you think there are the challenges and successes? And because you are the vice chair of the board, you know, what kind of role do you see for our board members to play in mobilizing additional resources for TB? So Austin, please go ahead.
Thank you, Lucica, and thank you to the organizers of this TICAD pre-event. I think I look at the time we're running, the time is actually running, so I'm going to be quite brief and straight to the point because there's, I mean, a lot of information out there in terms of what civil society have been doing out there, but the most important is also for us to look at, you know, the evidence, you know, all this while we've been talking about where is the evidence, you know, in terms of how to engage civil society, and we have quite a lot of evidence coming from the community rights and gender tools that are being implemented in a lot of countries now in Africa. We talk about the CRG assessment, the TB assessment as well, and the community-led monitoring. I mean, I think the community-led monitoring, which is the way to go, because we have countries implementing this One Impact tool, which gives you real data in terms of on a daily basis, you know what is happening in the communities, so that you can be able to have an informed early decision around So for me, I think civil society has been very critical in terms of helping to also create demand, for health services. But we've not been able to reach that milestone, because if you want to really engage people, to play a role, they have to be organized. These people have to be mobilized and also empowered, given to the right resources to be able to engage in such activity. And it's not just that because the civil society within TB, but for me, I think TB is already marginalized, and the civil society also who are also working are not apart with other diseases like HIV and all that. So we need to have a strong commitment, because the needs that is out there has always been, how to continue to empower civil society, and it's still the same need that we still talk about tomorrow. If you look at some of the global health participation in terms of financing in Africa, it's only coming from the Global Fund and a little from the USAID. We have in many countries it's just zero domestic financing, which is very critical. We need to focus on making sure that civil society are well organized to be able to champion advocacy around domestic financing. And the Stop TB Partnership is doing well around that in creating a lot of strong networks like Africa Coalition on TB that is helping to also do a lot of advocacy around resource mobilization. We have all these TB people also creating chapters in African countries as well, like that. But coming back to the Stop TB Partnership leadership, I think our global plan, the global plan to end TB that we just launched, emphasize on a lot of, in terms of fully funded global fund may not give us, all the leverage in terms of what we need, to be able to end TB, because the global plan to end TB has a lot of resource gap, and also is a very big tool for us to be able to advocate, for more resources in the TB programs. If we're able to finance the global plan to end TB, I think we should be heading somewhere. And this is why we need strong domestic resource mobilization. And again, I am also a board member. So at the board leadership over there, they are all advocates. They are all advocates for the fully funded global plan to end TB, not just for the partnership secretariat, but for the countries to be able to have resources to work in the countries. Thank you.
Thank you, Austin. And now I want to thank our amazing panelists. I want to say that the time is running, as Austin said, so I'll go further, passing the floor to Sahu for the introduction of the two colleagues speaking with us further. Thank you.
Thank you, Luchika. So we will have, now we have Ikuo Takizawa, the Senior Deputy Director General and Senior Director, Office of COVID-19 Response, Human Development Department, Japan International Cooperation Agency, for some special brief comments. So the floor is yours, Dr. Takizawa.
Well, thank you very much for giving a chance for JICA to contribute to this important seminar. It is too important to miss. So traditionally, JICA's contribution to TB control was mainly through technical cooperation for sustainable capacity development, and many countries in Africa benefited from training in Japan or technical support by Japanese experts, especially in the area of laboratory strengthening and sputum smearing. But recently, we are increasingly applying concessional loan to health sector assistance. Specifically, we are extending policy loans to support policy reforms toward universal health coverage in African countries such as Kenya, Senegal, and Cote d'Ivoire. Though the disbursements are linked to specific policy actions related to promote universal health coverage, the fund itself is extended as general budget support. Therefore, it allows the recipients to have control over how the fund is spent. And of course, we are making sure that there is good communication and cooperation between the Ministry of Finance, which is the principal recipient of the fund, the loan, and the Ministry of Health, which is mainly responsible for the policy actions. And in fact, engaging Ministry of Finance in the national UHC discourse is one of our aims in using policy loan as an instrument to promote universal health coverage. And we are hoping that health, especially TB, is prioritized in the internal budgetary process of the recipients. And looking back, Japan's own history of UHC development back in 1950s and 60s, the burden of TB was so big, and it was directly financed from the tax instead of universal health insurance scheme, which was still new and financially fragile. With the same analogy, it may make sense to finance TB and other diseases with significant financial burden from the donor fund, while the health financing schemes are being developed in African countries. But that has to be a temporary solution, and African countries should take up the responsibility of financing TB and other essential health programs from their own resources. And we hope our technical and financial support toward universal health coverage will help our partner countries to build robust and sustainable health financing schemes, which covers TB program as well. Thank you very much. Over to the facilitator.
Thank you, Dr. Takizawa. In a brief intervention, you mentioned many things there. So thank you. Also, the experience of Japan, of how Japan went ahead with TB as part of the universal health coverage. So thank you for that, and also the new information on the financial support, and also what you said about domestic funding in the future. So now we have gone over time. We will not have enough time for question and answer. I see that a number of questions and comments were on the question and answer chat. I would encourage people, if you have some more, you can put it there and we will get back to you on the responses. So we will go straight to the closing. And in the closing, we have with us Dr. Eiji Hinoshita, who is the Assistant Minister for Global Health and Welfare, Ministry of Health, Labor and Welfare in the government of Japan. Sir, the floor is yours.
Thank you. Dr. Ruchikadityu, Executive Director for Stop TB Partnership, Dr. Amit Dao, Regional Director, Africa, Human Development Practice Group, the World Bank Group, distinguished delegates and ladies and gentlemen. Let me begin by thanking all moderators and speakers for their significant contribution to the success of this side event. It is my great pleasure to provide this brief statement at the end of this important session, securing the finance to save lives in Africa from tuberculosis. At the ending of this side event, I'd like to highlight 2 points. As a reference, 1, Japan's history of how we address TB, and 2, Japan's contribution to the global TB response. First, I'd like to introduce Japan's successful history in how we addressed TB. In Japan, since 1930s to 40s, TB infected many citizens and became the #1 cause of death. Then, Japan started its TB approach with the TB prevention law legislated in 1951. Based on this law, the government of Japan established a program for screening and treatment of TB all over the country, followed by the registration and management of TB patients. These interventions contributed to the remarkable reduction of TB patients by 10% annually, the fastest speed in the world at that time. This was an unprecedented accomplishment in the world. In addition to this, the introduction of universal health coverage by the National Health Insurance System and allocation of public funds for TB treatment greatly improved access to medical services and reduced the self-burden. TB-related expenditure was more than 25% of all over health expenditure at that time, and I'd like to underscore that this was managed solely by domestic financing. The second point is Japan's contribution to global TB response, especially in Africa. For over 50 years, as a country with those experiences, Japan has continuously given support to the international TB countermeasures. Through the Stop TB partnership, Japan supports the provision of innovative diagnostic equipment and drugs to TB endemic countries. In particular, we target to reach and treat children with multi-drug resistant TB. Japan has also supporting the R&D of medical supplies through initiatives including the GHEAD Fund and UNED. The last but not least, the government of Japan has been providing approximately $4 billion to the Global Fund. As the Global Fund provides 77% of all international financing for TB, we look forward to the continued coordination between the Stop TB partnership and the Global Fund to lead the fight against the TB at global, regional, national, and community level and enhance mitigation efforts to regain lost progress caused by COVID-19. Ladies and gentlemen, this side event was held well timed toward the next year's UN High-level meeting on TB. We expect further leadership by the Stop TB partnership in coordination with civil societies and other global partners, leading to the high-level meeting. In conclusion, Japan is continuously committed to taking the leading role in global health, including TB, and strengthening health system. I thank you.
Thank you, Dr. Hinoshita. That was very good, and also how you described Japan's experience with TB. So we have come to the end of the meeting. Let me just say at the end that in this meeting, we focused on a subject which is a serious one. 550,000 people dying in Africa in a year, every year, of a disease that is preventable, can be diagnosed, can be treated up to cure. And the mortality is 23%, imagine, compared to COVID mortality, much, much higher. It is now upon us as partners to see that at least adequate funding is there to prevent this disaster from happening. We heard the perspectives from the countries, how they do the budgets, they don't have enough funding. We heard the perspectives from World Bank, what instruments, financial instruments are there. We heard the perspective of WHO. We heard from African Union on political engagement. We also heard from the Copenhagen Consensus think tank group how TB is a smart investment. And we also heard the perspective of the Japan government. So we will continue to follow up from Stop TB partnership on this important issue of financing for TB in Africa. If you have any comments or questions, please write to us on this subject, and we will make the recording of this meeting available at our website, and we will send out to all participants an email with the link for that. I also put my email address there. If you want to send anything, any comments, please send. I will be happy to engage and respond. So thank you all for your time, for connecting from different places of the world for this important subject. And thanks to our partners, World Bank, who co-organized this meeting with Stop TB partnership. And thanks to TICAD for approving this as an official side event. And thanks to everybody else who worked for this. I must thank my colleague, Shin, who is on this call, without which this meeting may not have happened. So thank you all, and goodbye for now. Bye.
Thank you. Bye.
Thank you very much.